Good morning, guys. Yeah, my name is Anshuman Kumar. Uh, a couple of things that I'm going to be addressing today is about looking at the madness of the medical system in the United States and what I and my company have done to counter this. So, today I want to talk to you about something that affects every single one of us, not someday, not hypothetically, but inevitably healthcare. More specifically, I want to talk to you about how statistics expose how irrational, unequal, and frankly unbelievable parts of our medical system really are. Most people think of medicine as a perfect combination of science and compassion, a world where data guides decisions and doctors save lives. And yes, at its best, medicine is exactly that. It's innovation, precision, and hope. But when we stop looking at inspirational stories and start looking at the numbers, we see a very different picture. The statistics don't just suggest problems, they prove them. And what they show is a system filled with gaps, contradictions, and injustices that should not exist in any country with some of the most advanced medical technology in the world. I didn't just learn this from reading reports or looking at charts. I've seen it firsthand. I've talked to patients, listened to families, and observed how complicated it can be to get basic care. I've watched people delay treatment because they were afraid of the bill. I've heard stories of families choosing between medication and groceries. Those moments stay with you. They make statistics feel less like numbers and more like people. Let's start with access. In the United States of America, millions of people are uninsured or underinsured. In 2024, more than 28 million Americans had no health insurance at all. Think about that for a moment. That's not a small number. That's roughly the population of an entire large state living without guaranteed access to doctors, prescriptions, or emergencies. Uh, Imagine having a high fever, broken a bone, or severe pain, and hesitating to go to the hospital because you don't know if you can afford it. For millions of Americans, that isn't imagination, it is a reality. And even for people who do not have insurance, the cost can still be overwhelming. The average cost of just one night in the US hospital is over $11,000. That's more than many families pay for rent or a mortgage in a month. One expected medical event can wipe out years of savings. Medical debt is one of the leading causes of bankruptcy in this country. That means illness doesn't just threaten your health, it can threaten your entire financial future. Now you may think, well, maybe it's inexpensive because it's the best system in the world, right? That sounds logical. But if we spend more, we should get better results, right? But here's where the numbers tell a shocking story. The United States spends more on healthcare per person than any other nation on the planet. Over $12,000 per person every single year. Yet, despite all that spending, our life expectancy is lower than many countries that spend far less. Nations that spend almost half as much often have longer lifespans and fewer preventable deaths. So we're paying more but not living longer? That's not efficiency. That's a warning sign. These aren't just statistics on a page. They represent real lives, real families, and real stories cut short. When we talk about disparities, we are talking about people who didn't get the same chance to live simply because of circumstances they were born into. A fair healthcare system should never depend on your background, but right now it often does. Mental health is another key sector where numbers are alarming. Nearly 1 in 5 Americans experience mental illnesses each year. That means if you look around this room, statistically, several people here either have struggled, are struggling, or will struggle with mental health challenges. Yet, despite how common it is, there are still not enough providers to meet the demand. Many insurance plans offer less coverage for therapy or psychiatric care than for physical conditions. So people who need help often wait months for appointments or never get one at all. When mental health goes untreated, it doesn't just affect emotions, it affects physical health, relationships, school performance, and careers. Ignoring mental health isn't just harmful, it's costly both socially and economically. Prevention and early treatment are far cheaper and more effective than crisis intervention. Yet our system still prioritizes treatment after things get severe instead of support before they reach that point. And then we come to inefficiency, the silent drain on the entire system. Healthcare providers often duplicate tests, not because they want to, but because systems don't communicate well with each other. Patients fill out same forms again and again. Doctors spend hours on paperwork instead of with their patients. Billions of dollars go toward administrative costs that never touch a patient's care. In fact, studies estimate that hundreds of billions of dollars are wasted every year in the US healthcare system due to unnecessary services, inefficiencies, and excessive bureaucracy. Just imagine what could happen if we wasted that money and redirected it somewhere. We could expand access, we could reduce costs, we could support nurses and doctors, we could invest in preventive care, we could save lives. So, why does this madness continue? Part of the answer is profit. Many of the healthcare system and companies are structured like businesses, and businesses are designed to make money. Insurance companies, pharmaceutical corporations, and healthcare networks often have financial incentives that don't always align with patient well being. Life saving medication can cost thousands of dollars per month, not necessarily because they cost that much to produce, because the system allows it. Another reason is complexity. The healthcare system is so complicated that even experts sometimes struggle to navigate it. Policies, regulations, billing codes, coverage rules, they form a maze that patients must somehow figure out while they're sick, stressed, and vulnerable. A system meant to help people shouldn't be this hard to understand. Now, I want to be clear. This speech is not an attack on doctors, nurses, researchers. In fact, they are the strongest advocates for change. Many healthcare professionals enter the field because they genuinely want to help people. They work long hours, they make sacrifices, and save lives every day. The problem isn't the people, it's the structure they're forced to work within. My passion for this issue didn't come from statistics alone. It came from witnessing situations where care was delayed, complicated, or unfair. It came from seeing how much difference good care can make and how devastating it is when someone can't access it. Those experiences made me realize something important. Awareness matters. When people understand the data, they begin to question the system. And when people question the system, change becomes possible. Statistics aren't cold or emotionless, they're just evidence. They reveal patterns our eyes alone might miss. They expose injustice, they tell stories that might otherwise go unheard of. And right now, those stories are telling us loud and clear that our healthcare system, despite its brilliance and innovation, still has serious flaws that need fixing. But here's the hopeful part: systems created by humans can be improved by humans. Every reform in history, from public sanitation to vaccines to patent rights, started because someone looked at the evidence and said, we can do better than this. Progress happens when people refuse to accept unfairness as normal. Imagine a healthcare system where no one avoids treatment because of cost. A system where quality care is consistent no matter who you are. A system where mental health is treated with the same urgency as physical health. A system where efficiency means more time with patients and less time with paperwork. That kind of system isn't impossible. The numbers show us the problems, which mean they can also guide us towards the solutions. In conclusion, medicine today is a paradox. On one hand, it's full of brilliant minds, groundbreaking technology, and life saving discoveries. On the other hand, it's weighted down by inequality, inefficiency, and barriers that should not exist. If we ignore the statistics, we ignore reality. But if we listen to them, they become a call to action. That was the saying or the quote that inspired me to start the project called USCAPES. At USCAPES, we went to a lot of senior homes, we did data, and around 75% of the seniors living in these homes either had no family to take care of them or had no one to like pay for the medical bills. And half of them, when we talked to them, they couldn't even hear them. So we did market research and we found that hearing aids online or on the web, like Zebra, for example, cost thousands to $2,000, and usually insurance covers that. But how is an elderly person with no family, no insurance supposed to pay that? That's why we got a $10,000 $10,000 funding from an organization called Lead for Change to start these hearing aids that are not only cheap but they're AI powered. So you could first of all talk to them in one language, and it will translate them to another language with the app. And you could also like see our website at uscapes.ai. And right now, we're still in the working process or in the working phase with getting a partnership with Microsoft, as they are pretty interested in funding and partnering with us. So, yeah, thank you.
Yeah, thank you for that talk, Anshuman. I think that was incredibly insightful on the realities of healthcare. And now I'll give it off to my co-founder, Kaveen, to read a Q&A question if we have any.
So we have one Q&A question that I want to quickly go over before we go to the next talk. So once again, a question from Stephen. There are many solutions and attempts to solve the mental health problems in schooling systems. What do you think about them, and what do you think is the most efficient?
Yeah, so personally, I kind of like them, but I also despise them. I'm like 50-50 on it, because the medical health problems at schools, they're really inefficient. Because if you look at statistical data, more than 50% of like students have mental health issues, and there's so many counselors there are at school, right? How can one person handle so much being? And these counselors at the schools, they barely give enough time to even listen to one or even understand where they're coming from. So because of this, uh, I think it can be better, as right now it's not really that good. Actually, a major thing is before getting a mental illness, I've actually partnered with a company called Contemplate. This company basically uh, has a course online. You can check us out at contemplate.ai. It basically finds ways to overall prevent depression, prevent mental illnesses through like finding yourself and overall understanding the world. Basically, this app that I've partnered with and I'm currently working with prevents mental illnesses and prevents depression. So I would probably use that, and I think overall that's a really good question, and I feel like schooling and mental health institutions can do better.
Okay,
Okay,
thank
perfect.
you.
Thank you.
Thank you, Anshuman. That
Yeah.
was a great talk, very insightful.
There is always an opportunity to contribute to the discussions that we have at EnviroCast Geo. If you are interested in attending or even speaking at a future conference, learn more at geo.envirocast.org. We're excited to hear your insights.